Okay. Oh, hi. Well, welcome to everybody. Um, yeah, so again, my name is, I say Brigitte Sabourin in French, but Brigitte Sabourin is fine as well. So what I'm going to try and do is just spend the next 30 or so minutes sharing some of the things that I've learned in the 7 years that I've been working at the pain clinic, supporting hundreds of people with chronic pain and also their loved ones. So, and some of what we will talk about might seem quite simple. They might be things that you know already. But what we do know is that sometimes we get caught up in our day-to-day lives and we forget to do those things that are good for us, or we lose track of what's good for us. We kind of fall off the wagon, let's say, in terms of taking care of ourselves and living the best life that we can. And so hopefully this talk will give you a chance to reflect, to recognize in yourself when you are using these strategies or you are kind of living the best life that you can. Maybe give yourself a pat on the back if you are. And then maybe think about, how to start to use or reincorporate some of these strategies that I'll be talking about if you haven't been using them yet. And I'm just curious, of all the people here, how many people are people with chronic pain and how many people are people who are kind of support people or the loved ones? So can anybody who's got their their camera on, if you can lift your hand up if you are somebody with chronic pain. I'll just see if, okay. Well, most people don't have their cameras on, so. Okay, so we'll just assume that there's a bit of both going on here. And so I'll kind of spend the first part talking about chronic pain and the second part talking about kind of if your loved one has chronic pain. So I guess my first question is, which of these people are in pain at this moment? And how do we know someone is experiencing chronic pain or is experiencing pain? And we know that pain is often invisible, and we can't know by looking at a person if they're experiencing physical pain or not. And this can make it really challenging for those in pain and for their loved ones. And just to remember that, I think that's a very universal experience, is that challenge of this invisible condition that that sometimes can make people feel misunderstood, or that other people may not believe them, or it just adds that extra challenge to living with chronic pain. So I want to talk a little bit about the difference between chronic pain and acute pain. So chronic pain is pain that persists beyond the time usually required for the healing of an injury and illness. And it can also occur without any ongoing tissue damage. So your doctor might say things like, well, it looks like you've healed, or it looks like we can't see anything wrong with it. Oftentimes, it can be fixed or cured, but we know that it can be eased. We know that suffering can be reduced. And we also know that with chronic pain, you are no longer a passive recipient in your healthcare, but an active participant in pain management. Pain is like an alarm system, and sometimes I equate chronic pain as an alarm system that isn't quite working, and kind of like if your fire alarm was going off in your house every time that you make toast. And that's one of the ways that people can understand, the nature of chronic pain. So some of the myths of chronic pain that, we always want to dispel when we first meet our patients, and just make sure that we're all on the same page in terms of our understanding of chronic pain. So the myth that, it's all in your head or you're making it up. And we know that, there we go. We know that it's not all in a person's head. We know that pain is a brain-body experience, but it's real. And we believe pain is whatever the person says it is. The other myth is, if you can't see it, it isn't there. And often there isn't any visible signs or identifiable causes of chronic pain, but it doesn't mean that it's, not any less present or any less real. The other one is that can create some frustration with people, as we're in 2021, look at all the things that we're doing with space travel, with technology, and so medical advances should be able to cure it. And unfortunately, we do know that medications and other kinds of medical treatments can help to reduce the pain, but there's seldom a cure. And even one-time treatments like surgery is not a guarantee. And sometimes, people find that their condition worsens or they get other problems after surgery. The other one is, people with chronic pain are just lazy, and we know that that's absolutely not true. And so many people that I've known with chronic pain have been overdoers their whole lives, having people who've taken care of so many different other people in their lives and just go, 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 go. And, many people with chronic pain do become quite sedentary, but it's definitely not their usual pattern. There's also this, if I work hard enough, I can beat this pain. If I can do this, if I can do that, I can beat it. And again, we know that beating the pain through willpower effort doesn't work, but rather, we kind of talk about learning to relax our bodies and our mind and learning to let go of that struggle or that fight against chronic pain and focusing our energy and our attention on trying to live the best life that we can and do those things that really matter to us. And the last one is kind of this feeling that people might have about I'm being punished or I did something to deserve this. And we know that nobody here did anything intentional to deserve this. I like to just show this just to kind of put it all in one place in terms of what living with chronic pain, the impact of it and how it can impact all our different areas of our lives, right? It's not just a physical kind of thing that happens to us, but it impacts our daily activities, what we can do on a daily basis. It impacts our relationships, or it can impact our relationships. It can lead to a lot of really difficult types of thoughts, like blaming ourselves, thinking I can't cope, thinking that I'm letting other people down, those kinds of thoughts that are really hard to have. And it also can be associated with these difficult emotions like frustration, anger, and sadness. And so it's really kind of a full life experience for a lot of people. One of the ways that we understand chronic pain is that nerves from different parts of the body, so from the part of the body that experiences pain, travel all the way to the brain via the spinal cord. And so they travel to the brain, and then all this stuff happens in the brain, and then they travel back. And along this kind of like highway, let's say, of messages, they pass through these gates. And these gates is just these, I guess, factors that can allow more pain messages or less pain messages to travel to and from the brain. And we know that the pain messages can be affected by physical states, psychological states, and emotional states. When the gates are open, more pain messages go through, we feel more pain. When the pain gates are closed, less messages go through and less pain is experienced. And so we think about what are those factors that can impact, what opens and closes a pain gate. We know that stress and muscle tension for so many people is associated with increased pain. And we know that relaxing our bodies, relaxing our minds, getting into that really relaxed state can help to lessen the pain and close the pain gate. We know that either too much of activity or not enough activity also can increase pain, whereas a regular activity pattern that we'll talk about a bit more in a few minutes can help to manage the pain or close the gate. We also know that when all of our attention is focused on everything that pain has taken away, all the negative aspects of pain, fear of increasing our pain, anger, depression, all those things, that can also increase the pain. And we also know that when we are focused on valued activities, on goals, on doing things that are really meaningful, we can help to close the pain. So a question that we can ask ourselves is, how can I spend more of my energy, more of my time on the right side of this picture, right? What are some of the things, even if they're just small, tiny things, that I can do today in one of these areas on the right to take care of my body, take care of my well-being. So if you think about the alarm system example I gave earlier, right? So the nervous system becomes like a fire alarm that goes off. And so we think, how can I calm my central nervous system, which is the brain and the spinal cord? How can I calm and decrease that alarm or that threat? And one thing we do know is I often get a lot of patients, for example, who might have some anger. They might have anger at their pain. They might be angry at the healthcare system and frustrated. They might be angry or frustrated at insurance companies or at others in their lives for not getting it. And although the anger is understandable, we also know that in the end, all of that anger can actually increase pain. And so again, trying to let go of this anger, trying to focus our energy on relaxing our minds and bodies, making that small and not always so easy shift from I can't do something, this is what I've been robbed of, to what can I do? What is still possible for me? So again, you're really focusing our attention and our energy on that which matters to us, that which give life meaning and fulfillment. And if anybody here has had kids or grandkids or nieces or nephews, if you've ever noticed that when you're playing with those kids and you're just having a really good time, that pain sometimes kind of goes to the background for a bit, right? And that's because our energy and our attention is focused on something that's really pleasurable, that's really calming, and that's really enjoyable and important to us. I want to just talk a little bit about relaxation, and I think we've got a couple of minutes where we can practice this a bit if you're open to it. I usually do these in person. It's a bit easier to do these in person, but we can just do maybe like a really brief 2 or 3 minute exercise if you're open to it, where we're just going to kind of sit back, and if you're comfortable closing your eyes, or just, softening your gaze to a spot on the floor. And just starting to focus our attention on slowing down our breath, on breathing easily and slowly. Perhaps breathing in through your nose and out through your mouth. Perhaps even on every out breath, saying a word like relax or any other calming word in your minds as you do this. So breathe in, relax. Perhaps as you're doing this, also just scanning your body briefly and just letting go of any tension in your jaw, your shoulders, your legs, and just feeling this relaxation sensation in your body as you breathe slowly and easily. Relax. And you might even take 5 more breaths like this, counting on the in-breath. And so 1 on the first in-breath, relax on the out-breath. 2, relax. And just scanning your body again. letting go of any tension, allowing yourself to just be here right now in the comfort of wherever you are, just with nowhere to go, nothing to do, just sitting here calmly and relaxed. And then whenever you're ready, just opening your eyes, coming back to the room, and welcome back. And so just to let you know, that was about 3 minutes. We recommend for people to do that 10 to 20 minutes once to twice a day. And it really helps to calm our central nervous system, kind of reset our bodies and our minds. And it's just a really, really helpful way of managing pain, managing stress, focusing on well-being, and taking care of ourselves. And so if some of you are doing these kinds of relaxation exercises, then, good job and keep doing it. And if some people aren't, then see if that's something that you can reincorporate. And, if you're Reh-Fit members, you can even do this as you're stretching, at the Reh-Fit and cooling down after a workout. You can do this at home. You can do this before bed when you first get up. One of the things that we say is we have our breath all the time. It's free, it's easy, and there's no side effects. So it's about one of the best medicines that we can give ourselves. Okay, so I want to talk a little bit, shift gears a little bit, and talk a little bit about what goes on in our bodies with chronic pain. And I'm going to try and explain these two diagrams. They might look a little complicated, but they're not really. So on the left side here, where I'm circling with the mouse, is what our bodies are like pre-injury. And so the bottom here, you see what's called stress or strength, and that's how much stress we're putting on our bodies. And I know one of the physiotherapists who often gives talks, she talks about this as an example. If I've got my finger and I'm pushing my finger back, how much I push my finger back is kind of like that stress or strength. Or it could be how much I'm walking or running or exercising or doing something. And over here is how much our tissues can take or can handle. So as we go, as the stress or strength gets stronger and stronger, we get closer and closer to that tissue damage. So the more I go like this, the closer I am to hurting myself. If I get to this alarm signal, right, the alarm is working really well, and it's a really good signal that, ouch, I better stop because I'm going to hurt myself. So this is all well and good before an injury, before chronic pain. What happens in chronic pain for many people is what we call the sensitized nervous system. And that means the nervous system is more sensitive to the stressor strength. So as you see here, we're going along, increasing the stressor strength, and oops, there's the alarm signal way before the tissue damage. And then if we keep going, we get into this flare up, right? So the alarm is the pain. The flare up is that, I don't know if anybody has pain or knows pain, but it's one of those things where they say, like, I did so much the next 3 days, I was just flat in bed, or I just had this big flare up in pain, or, so I didn't harm myself, but it was really unpleasant and it lasted quite a bit. And so in chronic pain, again, the tissue is not as strong. So I can't go as far this way. Maybe when I go like this, it starts to hurt. And if I go like this, I might get a flare up. I haven't hurt myself, but we know that by challenging the alarm system, so that means sounding the alarm without getting into flare up. So coming kind of into this, like we kind of call it that sweet spot. We let the alarm sound a little bit, and then we back off a bit, and we let the alarm sound a little bit, and then we back off a bit. And what we're really teaching our body by doing that is we're teaching our nervous system that there isn't anything to get alarmed about, that there's no harm or no hurt being done. When we get into the flare up, too often, then we're just taxing our nervous system a bit too much. If we stay too much here, well, then that means we're not doing much of anything. So we want to just challenge that alarm system. And I want to show it in a bit of a different way, because we all learn kind of differently. And so if you think about activity styles, there's two sort of main activity styles in people with chronic pain. Some people can kind of vary from one to the other. Some people are mostly the first, some people are mostly the second. So what these graphs are showing is this line at the bottom is called protect by pain. Protect by pain means that this is when I'm first experiencing the pain. That's the alarm. And then this line up here is called the flare up. So when we underdo, when we're scared of hurting ourselves so much that, this is activity level. So we start doing a little bit more and then, oh, I'm so scared I'm going to get hurt. I better stop. So let's say you're trying to walk and you walk for 3 minutes and you're like, oh, last time I walked for 5 minutes, I hurt. So I'm just going to stop now and I'm going to go and rest. And what happens is, well, we become deconditioned. We do less and less and less, and we're able to do less and less and less. Our body becomes weaker and weaker and weaker. The other pattern we see a lot is this boom and bust cycle, right? And this is the people that, there's a number of reasons why we get into this boom and bust cycle. One is people who kind of say, I'm not going to let this pain beat me. I'm not going to let it win. I'm going to beat this pain. I'm going to show this pain. So I'm just going to go, and to heck with my body and the pain. And they say, go. And then they get into flare up and then they're in bed for a couple of days. And then what might happen is that then, they're in bed a couple of days and then they have a good day or a less challenging day. We kind of call them easier and more challenging days, just to soften the language a bit when we're thinking about these things. So we're having an easier day and we're like, oh, I got to make up with all of this time. I got to make up for all this time I lost, right? I was in bed for 3 days, so now I got to make up for all this time. So I got to go until I can't go again. And so we boom and then we bust, and then we boom and we bust. And we know that when we get ourselves into this pattern, unfortunately, because our alarm gets more and more sensitized and because we're booming and busting so much, what we can do overall becomes a lot less. So I imagine that you guys might, from this, kind of figure out what we would recommend in that sweet spot, right? Is finding the baseline, finding what might increase pain a little bit, but not get into flare up, and then just sort of slowly increasing little by little to not get into flare ups. And here, if we think about the difference between these two and this, it's really important that we know ourselves, right? And it's really important that our loved ones also know, or that if we're the loved ones, we know what our partner is more likely to do. So if we know that we're more of a protect by pain kind of person, then it might be worth pushing ourselves a bit more, trying to do a bit more, taking a bit of more risk in terms of perhaps challenging that system. And if you're more an overdoer, then then it's maybe toning it back and stopping a bit sooner and just kind of resting a bit more, right? And so this is where working together as a team can be really helpful, because if you know each other and if you know yourselves, then you can try to recognize which pattern you fall into and then try and reverse that pattern. So I want to spend the next maybe 5 minutes talking about what might happen with chronic pain. So this is for you, anybody here who's a support person, a loved one with people with chronic pain. These are some of the things that you might hear from other people in your lives, right? And that really difficult to hear. So people might be saying, aren't they better yet? They're still in pain. Well, they should see another doctor, and can't anyone fix it? And then have you tried, or have they tried, right? And all of these, I call them well-meaning advice, but not very helpful usually. Or people saying, oh, I didn't invite you guys because I knew you probably couldn't have come. I didn't want you to feel bad. Or them saying, but they look so good. Aren't they back at work yet? Or they shouldn't be taking all of these addictive medicine. And so what you might be thinking in your mind, hearing all this, is, they're probably thinking that my loved one is either faking it, trying to get attention, doing something wrong, or taking advantage of the situation, right? And there's three things to keep in mind if this might be happening. And the first is most people mean well most of the time, right? They're just trying to help, or they think they're trying to be helpful. Second is sometimes when we're struggling and when we're in pain, we can misread what other people say, right? We can read more into their comments than what was intended by the comment. And so we might be interpreting or making some assumptions there about what they're meaning. And third, even if the occasional person does actually think these things or are kind of engaging in this not very helpful language, either, maybe they need to be educated, or if they are that insensitive or ignorant, then kind of like, who cares really? And I was doing a group actually just yesterday, and one of the group members says, I've learned how to say I can't care, right? It's not I don't care, just I can't care when people say these things that are not very helpful and just kind of nasty, or people are judging. I can't care. It's not worth it. So who cares? So if you're the loved one with chronic pain, right, these are some of the things that you might be feeling. You might be feeling guilty that you can't help more. You might be feeling angry at your loved one because they're irritable or they're withdrawn or they're hard to live with. You might be feeling resentful for having to do more around the house. You might be depressed or sad, or you have a sense of loss because your loved one isn't the same as before. You might feel anxious or stressed about the future, finances, other people. And all of these, they're understandable, but they're hard, right? They're hard emotions to have. And it's important to think, like, who can you go to for support with all of these difficult emotions? And these are some of the things that you might have to do, or that might get involved, right? Is you might be living on a reduced income, you might have to work harder, you might have to drive your loved ones to appointment, you might do more household chores, more childcare activities, more, spending less time on recreation and social. And you might become isolated. And so, it's really easy to people to say, well, you just have to take better care of yourself, or make sure you take care of yourself, or you have to spend some time on yourself. And we know that there's a lot of thoughts that can come in for loved ones, right? That can get in the way. There might be those thoughts like, well, that would be selfish. My loved one is, suffering and they're hurting. Like, I can't really abandon them and go take care of myself. What will people think if I'm off dancing or at a social gathering and my loved one's at home? I have to take care of my loved one. If I don't do it, no one will. I can't ask for help because that would mean I'm weak or I'm inadequate, or I should put other people's needs first. And if any of those are going on, maybe think, how would you respond to your best friend if they came up with all of these reasons why they can't take care of themselves? What would you tell your very dear friend about it? A lot of these messages that we tell ourselves, they might be things that we learned growing up. They might have been useful or helpful at some point in our lives, but at some point they're no longer useful, are they? Especially when life throws us a curveball like chronic pain. And so what are the things that you can do? Well, physical activity is probably, the one best thing that you can do for your well-being, right? It's, and this is just moving your body. We say as much as you can, as much as it's enjoyable. Socializing as much as it's enjoyable, even if these days it's a bit harder, but, hopefully now with vaccines and outdoors, but just kind of connecting with other people. Eating as well as you can, delegating responsibilities, right? Asking for help. Trying not to personalize your loved one's behavior, right? They're not grouchy at you. Perhaps there's a conversation that needs to be had, but it's not about them being grouchy at you. It's probably just about them having a hard time. And being gentle with them, but keep encouraging them to do as much as possible, right? Remembering that gate control model, remembering that pattern of activity. And so, being gentle and kind and kind of like a nice coach almost to that person. And then, making sure that you are doing those things to nurture yourself. It's really important. And sometimes I say, if you do feel guilty doing this, and I know women are terrible at feeling guilty, and we feel guilty about so many things in our lives, one of the things is feel the guilt and take care of it anyways. Take care of yourself anyways, right? Because what's more important, to feel a bit of guilt right now, or to be burnt out and get, feel that more of that resentment? I wanted to spend just 1 minute talking about intimacy because I know it can be really challenging, and there's been lots of research that's been done. And there's three, I guess, types of responses that partners can have when it comes to intimacy. And the first one is that solicitous, and that's that, oh, I don't want to hurt you. I want it, like, they're very concerning, very protective, very kind of like, I don't want to rock the boat. I just want you to be safe and whatnot. The second one is kind of that negative, that frustration, and that, sort of just negative. And we know that those two kinds of responses can actually increase pain, and it decreases kind of that, I guess, ability to connect with the other person, right? And they've noticed that there's some couples that they call it facilitative, and that's really focusing on the closeness, trying to be inventive, trying to problem solve, thinking outside the box. How can we show our affection to each other in a way that makes us feel connected and together, but that might not lead to a flare up or a lot of pain. And so again, just clear communication. Yeah, so just in terms of that communication, we do encourage people, if you've got chronic pain, don't mind read, right? We can't read other people's minds. We don't know what they're thinking. If you don't communicate with your loved ones, you're definitely not going to be heard. I actually had a patient who her friends stopped inviting her to things, and she finally communicated to them because she learned that they did that because they didn't want her to feel bad. And she just told them, keep inviting me. Like, I really want to be included. And if I can make it, I will for a bit. If I can't, I won't. But please don't stop inviting me. And their friends did that. They kept inviting her. And sometimes she was able to, go for a bit, or if she wasn't. But if she hadn't communicated that, that wouldn't have happened. So tell them how they can support you in a matter-of-fact way, right? It's not whining or complaining. It's just informing, educating, letting them know. If your loved one has chronic pain, right? Listen to their words and their actions. Be genuine, be patient and understanding. Believe them, when they say they're having a challenging pain day. And, positive reinforcement for positive behaviors, right? We are all human beings. We're like those kids. If we do something and we get ignored or we don't get any reinforcement, we're less likely to do it in the future. And so, if your loved one is trying really hard, is taking those steps, is making that effort, just kind of, again, be that good coach, right? That coach that kind of says like, yeah, that's awesome that you did that, or this is great. And also to be aware of your own nonverbal communication and the messages you might be giving your loved one with some of the things you may not be saying, but that might be having an impact. So just kind of a reminder, right? You and your loved one are on the same team, and you're in it together, and you're there to support each other. And so, yeah, so sometimes we forget that, right? And we get into this difficult patterns and difficult moments, but you're all on the same team. So yeah, and I found this on the web, and it says, you mean it's nothing but webinars? So I apologize for this being another one of these webinars, but thanks for listening, and I'm really I'd be happy to listen to some questions or comments or anything that you guys have to either share or ask.
Great. Thanks, Brigitte. Again, so if you're not sure, you can always use the chat box if you have any comments. Even that 3-minute of relaxation that we did earlier, I think I'm just, so calm. I'm just ready to kind of enjoy my evening. It was a great talk, lots of really good information. For anybody dealing with chronic pain, or ideally, you have a loved one dealing with it. So I think it's a great perspective for anybody. Maybe we didn't think of some of those things, and actually hearing them and kind of seeing them listed in your slides is really great. We can take that home. So if anybody has a comment or question for our presenter tonight, again, you can use the chat box. If you think of something later, you can put it on our Facebook page and we will get you the answer. or even maybe if it's a week from now, you can always contact us either at the center or on our Facebook page and say, remember that talk? I have a question. I want to see if we can get it answered. So I'll give you guys all to think a little bit. It was a great presentation. It's nice. We have much different weather this week than last week. Last week we had that terrible winter blizzard and it felt so horrible. So it's like a complete 360 tonight. So that's great. So hopefully we can all enjoy the weather and get out there. So if anybody has a question, you can go ahead. I will personally thank Brigitte. That was a great talk. We have another one starting next week. If you're thinking of your questions, next week, Tuesday, April 13th, we have Canada's new 24-hour movement guidelines with Dr. Jonathan Fowles. So if you've been paying attention to these talks and participating or listening to them after the fact, we had Dr. Jonathan Fowles, I think in November or early December. And he was very good speaker, well received. So he's going to be back with us next week. So you can join me then for that one. And we have a couple more coming up, but I won't tell you what they are. I like to keep you in anticipation so you all tune in from week to week. So if there's any comments, I think there was one. Thank you very much. Yes, absolutely, Dale. Thanks for that comment saying thank you, Brigitte. Otherwise, maybe what I'll do is it's nice to see those of you that have your cameras on. It's nice to wave and say hello. And sometimes I see you guys all at the center. So it's great to see everybody there. I will maybe say good evening, and that's great. You guys have all taken that information in, and maybe you're going to do a little relaxation before you go to bed tonight, and maybe do it first thing in the morning and see how it impacts your day. So thank you, everybody. Have a great evening, and we will hopefully see you at our Fit Talk next week. Thanks, everyone.
Have a good evening, everybody.
Thanks, Brigitte.
Okay. Bye now.